There are also the patients who have symptoms that they can actually see blood. When you see blood, sure, very scared, right? Then you quickly go and see doctor, right? So that is one way, but there are many patients who think they have urine tract infection, especially women. You have frequent urination, you keep having urgent, you must look for toilet. That is one form of cancer called carcinoma in situ of bladder, can have the same symptom as a urine infection. So many women may think it's UTI, urine tract infection. Remember, if it's not resolved, that means you keep taking antibiotic, but you keep having the same thing, it's best to make sure it's not bladder tumor or some other things. Because after taking antibiotic, it should be cleared. Okay? The other thing is, there are patients who have difficulty passing urine. A tumor may be blocking near where the bladder outlet comes out. It's like a stopper. You know, when your kitchen sink, you have a stopper. If a tumor blocks it, you may find difficulty passing urine. And if you cannot empty the bladder properly, you need to keep waking up at night. Because if you don't empty your bladder, it fills up very fast, correct? And then you have to keep going very frequently to the toilet. Yeah, so these are some of the possible warning signs about bladder cancer. What do we do whenever a doctor finds a bladder tumor? There are two main things we have to do. One is to resect it completely, meaning to remove it completely from the body. And the next job, most important, is reduce the chance it will come back again, because we don't want cancer to return. If you look at the urine bladder, okay, so I have a magnification of the bladder wall. You know your bladder have a muscle, this dark brown part. So there's always a layer of surface of urine, touches the urine, but there's a muscle. That's why your urine, when you have to go toilet, the muscle will squeeze the bladder and urine come out. But bladder cancer always form on the surface. If you look at the shape of bladder cancer, some look like a cauliflower, some look like a small hump, but there are some that are hidden, flat, you cannot see at all. They are called carcinoma in situ. That means it looks exactly the same. So if you do the best scan, you all know about CT scan, MRI, PET scan, cannot detect. Because if the tumor is flat, it's like a carpet, how would you be able to detect when you do a CT scan, MRI from outside? You can't tell. You can only see the big tree like a cauliflower type, but the flat type you can't see. Which is why whenever there's blood in the urine, one of the tests we always suggest to do is put a scope just to see and make sure there's no ulcers or no abnormal things inside. That's the reason why. Because some of the bladder cancer is actually flat, like a carpet. These are some of the shapes. I take pictures of some of the tumor we see. If you look at the top left-hand corner, it looks a bit flat, right? Next one, in the middle, or the right-hand side, it looks like like a coral under the water. So it can look like different shapes and sizes. Our job as a doctor, when we see the tumor, is to do a surgery called TURBT. It stands for transurethral resection of bladder tumor, meaning through the urine tube, we just scrape it off until the tumor is out of the body. So there's no scar in the body at all. So everything goes through the urine tract. And your friends or other people may not know you went for a surgery because there's no scar. So after we remove it, our job is to remove entire tumor. But remember, the most important thing is to know what kind of tumor it is. Why is it important? The most important thing is we want to know whether the tumor has taken roots inside. Imagine if you have a tree, how deep the root goes. Remember I told you there's a muscle in the bladder where it squeezes. As long as the roots of the cancer do not touch the muscle, it's good. It's called non-muscle-invasive. Everything on the left-hand side of my dotted line. It's very important because if the tumor, the root does not touch the muscle, you can keep the bladder. What happens if the root touch the muscle? We have to take out the whole bladder and put a water bag for the rest of the life. So it's very important to diagnose early before the root get into the muscle. Once it gets into muscle, the option is entirely remove, then carry a bag for forever, which nobody really wants. So, which is why we think it's good to be diagnosed earlier, especially when there's blood in the urine, and most people have no symptoms. So that's the key thing we want to highlight. what do we do? The first thing is to remove the bladder tumor called transurethral resection of bladder tumor. So the key thing is to know whether it involves the muscle or not involve muscle. If it involves muscle, it may be too late, we have to remove the bladder. But if it has not, first thing I tell everyone is stop smoking, because smoking actually causes a toxin to be kept in the urine, and it causes more bladder cancer. But of course, there are many patients who eat well, smoke well, exercise every day, also get cancer. I'm sure you all have heard of people. We don't know why it happens, but we do see patients who smoke have a higher chance of bladder cancer. So that's the most important thing. Second thing, there's this thing called intravesical treatment. Intra means inside, vesicle means bladder. Remember, after I cut away the bladder tumor, the big tumor I'll take out, but there will be some cells that are floating inside the bladder. Bladder is like a water balloon, right? So straight after the surgery, we will give chemotherapy inside the bladder to kill off the floating cells so that it doesn't drop down and be a seed, and then it continue growing. So it's called intravesical chemotherapy. I want to go through why is intravesical therapy so important. You have friends who have bladder tumor, but they don't get it, don't get this therapy, but I need to tell you, this is very important. Immediately after the surgery, we will give the chemo so that the floating cells is killed off. But after we receive the final histology, meaning the specimen, the report, 1 week later, we want to find out whether the cells contain any of these high-risk features. T1 high grade, these are words that tell me that if I don't get rid of it, it can come back again. So once I see this in the medical report of the surgery, the patient will need to go through another 6 weeks of intravesical treatment. That means they need more of this treatment within the bladder. They come to the clinic, takes about 2 hours, then go home. Okay, so far okay? Yeah. So that's the reason why you will find that patients with bladder cancer may need to keep coming back to get chemo within the bladder. The chemo in the bladder does not cause them to lose their hair or reduce their immune system because it's not given from the blood. It's just within the bladder. So it's, after that, they can go to work as per normal. So that's a special thing about this chemo given inside the bladder. And we have found that if you give it for a long, long time, including a medication called BCG, patients can live more than 15 years without problem. So this is the information that we want to say. Always do intravesical medication inside the bladder. So we've gone through the bladder cancer. What are the symptoms? Most patients have no symptoms. Some patients may have blood in the urine, and the urine, you may not see the blood. It can be microscopic. Or some patients present with urine problem, urine frequency, you keep going toilet, or you think it may be urine tract infection, while actually it's a bladder cancer. Why is intravesical therapy important? It reduces recurrence because we don't want cancer to come back. Okay? Any questions about bladder that you want to ask first? Can I go on to the next one? Okay. So the last one is prostate. So prostate only men have, all right? So 2 things I want to answer. First, how to avoid unnecessary biopsy. Many of us know about this blood test called PSA. This is actually a tumor marker called prostate-specific antigen, but they are not very accurate. This blood test can be higher in normal, aging prostate. It can be higher when it's infection of prostate. It can be higher when there's cancer. So it's not very specific for tumor marker, meaning doesn't mean once it's high, it's cancer. It may not be. It may just be infection. And once it's high, many patients may go through a biopsy of the prostate, which involve putting an ultrasound through the anus and biopsy. Some people do 4 times, 5 times, 6 times. Very uncomfortable. So we are finding ways how to reduce it so that we don't get so much unnecessary biopsy. So prostate, as you know, only men have, is just below the bladder, just below the bladder, okay, connecting the bladder to the penis. The function of prostate is when we have sex or ejaculation, when the sperm comes out, it gives nutrition to the sperm because the sperm must swim, right, in the woman. If not, there's no more nutrition or lubricant. That's why the prostate is there, to give the fluid. Okay, Prostate cancer, we know, is the third